Our next speaker will be Professor محمد Bamashmos. He's a professor in our Department of Medicine at Lصناعة University in internal medicine and endocrinology, and he will be to us on current versus novel strategies in the diagnosis and treatment of diabetes.
بسم الله الرحمن الرحيم. هو اليوم مفروض اليوم العالمي للسكري، صح؟ ففي شاعر قال على السكري سكري سكري، فقال: قد جاءني ضيف ثقيل مفتري، ذاك الذي أسموه زورا سكري، إذ ليس حلوا طعمه بل أنه العلقمي الحنظلي المرمري. فهو هذا السكري، صح؟ الكرنت فيرسس ما يخرج هذا. What is the current versus the normal strategy for diagnosis and treatment of diabetes mellitus? Diagnosis, usually the current strategy depends on the American Diabetic Association or in the World Health Organization Association for Diagnosis of Diabetes. If we rely in the fasting blood sugar, some patients with diabetes may have a normal fasting with elevated postprandial blood sugar. If we rely in the random blood sugar, they say that the random blood sugar plus symptoms, and about 20% of type 2 diabetic patients are clinically asymptomatic, and the majority, about 80% of pre-diabetes also, they are clinically asymptomatic. If we rely in the O1C, oral glucose tolerance test, the oral glucose tolerance test depends on the dietary intake, it depends on the presence or absence of stress, and also it depends on the certain drugs which affect the oral glucose tolerance test. If we rely on the hemoglobin A1C, as we know, the HbA1c is affected by many factors that decrease it, and certain factors which increase, false positive and false negative results. Also, the hemoglobin A1c nowadays there is a dilemma. المريض يقول لك يا دكتور أنا عملت الهيموجلوبين A1c in some lab, and the result will be, for example, about 8, and repeat it in the other lab at the same day, and the result is 9, and another lab the result was 7.5. So there is a difference in the lab results in the same day. This is what we face in practice. So they say that if the difference is in the range between 0.5 to 1, this is acceptable. If it is more than this, you have to choose a proper laboratory method for investigation of HbA1c, and they say that the most proper lab method is electrophoresis. But our lab, they say that the electrophoresis is expensive and we cannot use it for all patients. What about the novel strategy? Whoa, whoa, whoa. The novel strategy أول ال American Diabetic World Health Organization they fail. هم يقول لك the patient is diabetic. عملوا الكرايتيريا قالوا the patient is diabetic, but they failed to diagnose which type of diabetes. هل هو type 1 or type 2 diabetes؟ الآن which subtype of type 2 diabetes؟ هل هو severe insulin resistant diabetes ولا هل هو mild obesity related diabetes ولا هو mild age related diabetes؟ So they said that this patient is diabetic بس والسلام عليكم. So the novel strategy overcome it by two things. The first is called the clinical care decision. Any diabetic patient should be assessed for the age, body weight, and the duration of diabetes. The second is the laboratory decision regarding the entry A1C, regarding the assessment of auto antibody, and regarding the assessment of the presence or absence of insulin resistance by ordering for HOMA insulin resistance, and regarding the assessment of the beta cell function by the assessment of the C peptide, whether in the serum or the urine creatinine to C peptide ratio. This will solve the problem. First, it will differentiate between type 1 and type 2 diabetes. If there is a positive autoantibody, well, this is a type 1. The second, patient is with LADA, latent autoimmune diabetes of adults, previously diagnosed as type 2 diabetes. Now, because if you order for autoantibody, you will find that it is positive. So actually, LADA is a type 1 diabetes. The third, some patient may present to you with severe insulin deficiency diabetes. Severe insulin deficient diabetes. This patient has a very low serum C-peptide, but the autoantibody are negative. This patient can be treated with oral anti-diabetic drug rather than insulin. I have myself, I have about three patients who are present with, who are treated already with insulin, and I have checked for him the autoantibody. I found that it is negative and serum C peptide is low. So I am shifting this patient from insulin to oral, and very dramatic response occurs to this patient. The second important for this novel diagnosis is for prevention strategy. As you know, that the insulin resistance is the cornerstone for the cardiovascular and renal complication in diabetes mellitus, even in non-diabetic patients. It is important for prevention strategy for staging of diabetes, so I can type 1 or type 2, depending on the presence or absence of autoantibody and in the presence of insulin resistance. Insulin resistance will shift to pre-diabetes and from pre-diabetes to type 2 diabetes. It is important for choice a proper treatment. Any patient with positive autoantibody should be treated with insulin regardless of the age at presentation. The second is any patient with high insulin resistance, you have to avoid insulin secretagogues, the sulfonylurea. As you know, that when the patient came to us, we start treatment with sulfonylurea. This is very wrong because this causes a beta cell exhaustion and enter the patient to a beta cell dysfunction, and the patient will need insulin. It is important also for choice of proper treatment. It's important for expecting long-term complication of diabetes. Any patient with insulin resistance has a high risk for developing cardiovascular and renal complications. This is regarding the diagnosis. Regarding the treatment, there are two طبعا treatment of type 1 معظمها بتكلم عليها الدكتور زايد. بس if I am comparing the novel with the current with the novel strategy, the current strategy depends on the insulin treatment. They initiate insulin. The better is to choose, if we speak about the treatment pitfall, it's better to choose insulin analog rather than human insulin, because insulin analog has a short onset of action, so it can be given either before meal or even after meal in اللي هو very young patient في الأطفال لأنهم ينسوا to take a meal، أو في كبار السن لأنه عندهم some source of dementia فممكن they neglect to take a food. طبعا الميثود it's better to prefer nowadays your basal bolus insulin regime. لكن if we compare the novel عادة تعتمد على الستيج of prevention. أول ما تبدأ من early stage 1 in which there is a genetic predisposition without positive autoantibody. Stage 2, autoantibodies start to appear, but the beta cell function is normal and the patient is clinically asymptomatic. Stage 2 اللي بعدها the patient also has positive autoantibody and there is a dysglycemia. لكن stage 4 the patient is clinically symptomatic and diagnosed as having type 1 diabetes. The aim in the novel strategy is to prevent the progression of type 1 diabetes from stage 0 to the development of overt diabetes mellitus. Also, they said حتى لو المريض is diagnosed to have a type 1 diabetes in the first 5 years, FDA approved drug is infliximab, which is proved to decrease the progression of complication in type 1 diabetes. So what about type 2 diabetes? There is a novel classification regarding this. طبعا ده كله الدكتور زايد يتكلم عنه. لكن لو جينا للتايب 2 diabetes, we have a novel and we have what's called the current strategy and the novel strategy. The current strategy يسموها glucose centered approach. What you mean by glucose centered approach? When the diagnosis of type 2 diabetes is made, they concentrate only in achieving a target HbA1c. They ignoring the following. أول حاجة التارجت A1C should be variable according to the age of the patient, the duration of the diabetes mellitus, and the half-life if the patient have a short or long half-life, and the presence or absence of certain comorbidity, because a tight glycemic control has adverse effect in this patient, increase the risk of hyperglycemia, increase cardiac weight gain, and it has adverse effect in the cardiovascular outcome. يبقى current depend on the tight glycemic control. The current classification ignore the stage and the rate of progression of type 2 diabetes from overweight to insulin resistance, to pre-diabetes, and to type 2 diabetes, and to type 2 diabetes with complication. In the current, this is ignored. Like in the novel strategy, they concentrate in it. This is the stage of prevention is failed in the current classification. Treatment of hyperglycemia starts when the symptom appears. So it is called a glucose-centered approach, while the current classification يسموها
2 more
pathogenesis.
minutes يا دكتور.
ها؟ centered approach. باقي كم؟ 2 minutes. 2 minutes. طيب novel classification قلنا تعتمد على ايش؟ الستيج of progression of type 2 diabetes. The current classification, they treat the complication when it presents, or they classify the patient according whether the presence of escapade or heart failure or chronic kidney disease. Like in a novel classification, they prevent the complication before it occurs. This is very important one. They gonna concentrate in the stage and progression. They starting from obesity. They treat obesity when the patient body weight is more than 30 kilogram أو the patient weight أكثر من 27 kilogram per meter square plus presence of other risk factor. They concentrate in the treatment of insulin resistance even in the absence of diabetes, even in the normoglycemia, because they found insulin resistance will accelerate the rate of progression to pre-diabetes if it is not treated. And the treatment is concentrated mainly on the lifestyle intervention together with the use of other drugs, even if the patient is not diabetic. زي الميتفورمين glycogen like peptide receptor agonist or sodium glucose linked transporter 2 inhibitor. Then they go to the pre-diabetes. Pre-diabetes is ignored because the majority are asymptomatic. 80% are asymptomatic. It can progress to type 2 diabetes if it is not treated. تمام. The treatment also concentrate in the lifestyle intervention together with use of metformin or glycogen like peptide receptor agonist in certain situation. Then treatment of type 2 with diabetes without complication. The novel strategy concentrate on the prevention of the cardiovascular and renal risk factor before it prevent. This is called a prevention strategy before it occur. لكن current strategy they concentrate only, as you know, all algorithms divide the patient into two. A patient with the presence or absence of escapade or chronic kidney disease, or
Dr.
with the
Mohammed.
presence of risk factor, or a patient without risk factor. But they not concentrate in how to prevent the risk factor before it occurs.
Time is over. كمل كمل يا كمل.
A key point regarding the current versus novel strategy in type 1 or in diagnosis, the novel strategy concentrate in the etiology and pathogenesis rather than diagnosis of diabetes. يبقى لو قلنا fasting random postpone ده diagnosis. لكن the novel concentrate in the etiology. What is the etiology and what's the pathogenesis? So they order for autoantibody and insulin resistance عن طريق الهوما and assessment of beta cell function. This is regarding diagnosis. Regarding the treatment, the current strategy focus in what's called glucose-based approach, and they ignore the pathogenesis-based approach. The glucose-based approach means that any patient came to you with diabetes, you have to concentrate into how to reach a target A1C. This is what you need. You have to reach a target A1C without concentrating in the pathogenesis of diabetes. يعني واحد أول ما يبدأ بالإنسولين resistance. So it is very useless أو it is اللي يسموها misdiagnosis انك to start with insulin secretagogus while the patient still in the insulin resistance phase. Then the patient will go in the beta cell dysfunction. So it is better to give a drugs that stabilize and preserve beta cell and use a drug to prevent beta cell exhaustion. So this is called pathogenesis based approach. برضه current neglecting the stage and how to prevent it. النوبل concentrate on the stage starting from the body weight to insulin resistance to pre-diabetes to type 2 diabetes to type 2 diabetes with complication. While the current strategy ignore this اللي هو stage and prevention of type 2 diabetes. The third point that should be put in mind that the current strategy treat cardiovascular complication when already occur, while the novel strategy concentrate in the prevention of the cardiovascular and renal complication before it occur. والسلام عليكم.
شكرا جزيلا للأستاذ الدكتور محمد بامشموس على المحاضرة الرائعة.